My name's Gershon, good to see you, and you're watching MeloTV with the rooms of Dr. Asif Banderker. And should you require the services of a specialist and you have problems with your intestine system, Dr. Banderker is going to tell us all about what he does. Dr. Banderker, thank you so much for joining us right here on MeloTV. Please tell us, what do you do for a living besides being a doctor?
So, yes, family time, sports time, cycling, running, and spending time with the kid. Try and make some time for the wife also. Yeah, it's important to stay out of trouble, and then it's work. Yeah, that's life, simple.
Now, for yourself as a specialist, you look after people's health, especially when it comes to their intestine. Tell us more about that.
Okay, so I'm a gastrointestinal surgeon, and I subspecialize in liver and pancreas work. So I'm a liver hepatobiliary surgeon, so which means I tend to operate on people with surgical problems of the liver, pancreas, and the gastrointestinal tract, and that stems from the esophagus down onto the rectum and the anus. Unfortunately, most of what I do is emergency work and cancer work, unfortunately. However, that's not all that I do. I get a lot of people coming in with abdominal pain, abdominal symptoms that need some reassurance, some investigation, so that they feel that there's nothing to worry about. And some of it comes to my room, some of it comes as emergencies via the casualty. And I offer a service which is gastroenterology based. And yeah, we try and service the community over here and provide a gold standard academic service, really, in a private hospital. Yeah.
Let's look at what you do. Do patients sometimes feel ashamed to come and say to you, Doc, I think there's a problem down there?
Yes. So almost everybody is quite uncomfortable talking about down there. However, we make them comfortable, make them feel that down there is what we see 20 or 30 of every day, and normally makes them feel quite comfortable. And unfortunately, it normally takes a while before people speak about something uncomfortable down there. So, and it can range from something as simple as a little pimple to a hemorrhoid to something more sinister like a malignancy, unfortunately. But what's quite important is to have it evaluated and checked out. And whether that comes directly to me or via your GP, that's absolutely fine, as long as it's some medical professional has a look at down there if it's giving you some trouble. Yeah.
Let's talk about, for example, if someone is struggling to pass a stool and it's been going for a very long time. What are the alarm bells and what are the symptoms?
Yeah, look, I think what's important is the age of the person. If they're a 20-year-old or a 25-year-old young person with no medical problems, that's not really worrisome. But if you've got a 60 or 70-year-old person who's struggling to pass stool, that's quite worrisome. And also if they have some bleeding as well, and also if it's painful. I think all of those symptoms warrants specialist investigation and evaluation. And there's numerous things that could cause these symptoms, but what's important is to have adequate evaluation by a specialist, and we can sort it out quite efficiently, really. Yeah.
Let's look at yourself also. You were talking about cancer. It's something you don't really want to talk about.
Nobody wants to talk about cancer. Yeah.
It is real.
It's real, it's out there, and unfortunately it happens in young people and old people, and when you least expect it. The odd pain that you might have on the left-hand side that you thought might just be a wind, or the odd bout of blood when you wipe. Unfortunately, something as simple as that could be the sign that something more sinister is going on. And yes, the cancer word is out there, and we have to deal with it and treat it and try and cure people as far as we can. And if we can't, we would try and offer them some form of palliative therapy, essentially. Yeah.
If you look at yourself too, as a job that you do, you are a specialist. You specialize in the intestine system. What brings you the most joy in your job?
I think I must say, being in theatre, operating, is quite fulfilling to me. But more importantly, that you could actually cure somebody from, it doesn't have to be a cancer. It might be a gallstone that's causing some trouble, and we have various ways of sorting that out, minimally invasively as well. So for me, surgery or gastrointestinal surgery and liver and pancreas surgery allows you the opportunity to completely cure somebody of a potential disease. And for me, spending time in theatre is the best. I could spend, some operations last for 10 hours, and you'd easily spend 10 hours in theatre, and it's lots of fun. Yeah. For me, that's the most joy. Spending time operating in theatre, it's the best. Yeah.
What are the most common cases that you do see in your practice?
So I deal with a significant amount of cancer in my practice, and that does involve gastric cancer, liver cancer, pancreas, and colon. Unfortunately, a lot of my hepatobiliary cancer work is palliative, because most patients come to me when they are quite advanced, and we end up trying to relieve the symptoms by placing a stent, relieving an obstruction, and getting them some form of palliative chemotherapy. And it's unfortunately the nature of the beast that most patients, when I say most, about 90% of people who come with a pancreas malignancy, for example, we won't be able to offer them a cure, unfortunately.
All right, Dr. Banderker, in closing, what advice would you have to anyone watching this video and they're doubting whether they must come and go to their GP and then come and see a specialist like yourself, should they have any problems with the intestine system?
It's always a good idea to come early. The sooner you see a specialist or even your GP for your symptoms, just for assessment, just even if it means somebody tells you, don't worry, it's fine, come back in a week, we'll have another look. Just have that form of reassurance, and don't leave things. If your symptoms don't improve, even if your GP reassures you and you're not sure, go for a second opinion. Go to somebody else, come to a specialist, go to a different specialist, get second opinions, but get sorted out. I think that's quite important. There's no point in sitting at home suffering or being scared for symptoms that you might not want to talk about. So come forward, be evaluated, be assessed, be investigated, and if there's something sinister, have it sorted out. Be cured of a problem. If there's nothing, then you have your reassurance that there's nothing to worry about. But have the test done, I think, for at least screening and evaluation. Yeah.
Doctor, what is your thoughts of patients who first go to Google to find out what's wrong with them?
I quite appreciate that. It makes my job quite easy. It means patients have done some study work. They've have some insight on what might be going on. It gives them all the more reason to come and see a specialist. They have some form of clarity and reassurance, and also they ask all the right questions. It makes my job a lot easier. Having a patient who's well informed, knows what they're coming for, knows what the right questions to ask, know what they might be going for. So in my opinion, Dr. Google makes my job a lot easier.
Dr. Banderker, thank you so much for joining us right here on MeloTV.
Absolute pleasure.
Should you require the services of Dr. Banderker, the details are on your screen. You can get hold of him. He's on the 4th floor. It is Suite 1. I can tell you this, he's the best specialist in the business should you require your intestine system to be checked out. Thank you for watching, liking and sharing our video. From all of us at Melamed Hospitals and MeloTV, until next time, goodbye.